to this side is your right visual field, and it's going to go across to the brain, and it's going to see your left temporal part of the eye and the right nasal part of the eye is what you're going to see from over here. Right? So it's hitting the eye that way like that, and then the opposite's going to go over here. Right? So basically, when you're checking the second cranial nerve, you're checking for visual acuity. You know, how well can you see things, and you use the Snellen eye chart. Right? There's different versions of it. There's a smaller version. I thought they were supposed to be getting some here for Pecan, but I don't know. So visual acuity is how well you can see, and then they rate it like 20/20 or. You know, the higher number there is, the worse your vision is. Okay, so typically it's done at 20 feet. So then if you have 20/20 vision, you can see what a normal person can see at 20 feet when you're at 20 feet. Okay? And then if you have like a higher number, like 80/20, it means when you're standing at 20 feet, it really looks like you're 80 feet away. So you're not seeing as well. And if you have a lower number, it means when you're standing at 20 feet, if it's 15/20, then that means you can see at 20 feet what the normal person can see at 15 feet. And then myopia means nearsighted. So that means that they can see near, but you can't see when the things that are far away. And then farsighted is the opposite, or hyperopia, meaning that when you can see things that are far away, but you can't see things that are near.
Do you know anything about those machines that test visual acuity on the work?
You mean when you go to the optometrist?
Or on a driver's license review?
Yeah. Well, no, there you're still. I haven't had to take one of those for a while, so I can't remember exactly what they do. I think you still have to read something, so there's still chest and visual acuity. But when you go to an optometrist and they have that thing and they say, is that better, is that worse, or blur? That's where they're coming up with a prescription for lenses and things like that. So then there's other different versions of these charts. You know, you can have a handheld version. Typically, it's not normally something that you're going to be doing in your practicing, right? Test visual acuity. Originally, before I moved, we had an optometrist next door, so if we needed to check the eyes, just hey, go next door. But once in a while, like if I had to do some kind of an exam, like sometimes people for the DMV, like if they're going to get a truck driving license or something, they have to get an exam, and so we would have to do a visual acuity test. So just understand that there's different versions of these eye charts that can be used to check visual acuity. But then there's things that where you're doing the testing of visual field. So that's basically like mapping out physically what you can see where. You know, how far over to the side can you see your peripheral vision, going up and down like that. So basically the person is going to be sitting in front of the examiner. They're going to cover one eye, you know, use a card or something like that. And then you're going to have them look straight ahead. And then you're going to move your fingers in from one side, and then you say, tell me when you can start to see it. You know? Or you can say, like, how many fingers am I holding out, something like that. So let's say if I'm checking you, I'm going to have one eye covered, and then I'm going to be watching you so that I can see that you're looking straight ahead. Because obviously if you look with your eyes over here, you're going to be able to see farther. And so I may come in from the side like this, and then I'm going to ask you, you know, when can you see? So there, you know, what is that, a chipmunk or something? You got to be able to see what people are sneaking up on you, right? And then, like I said, you're probably not going to, I forgot to bring one in, but I can bring in an ophthalmoscope maybe next week. And basically that's the type of thing where you're looking inside of the eye And what you're doing is you're looking back into the retina and the optic disc and the fundus and things like that.
You want me to pass them out?
Yeah. And then, yeah, the master one, you remember which one? So we'll talk more about some of these terms like homonymous and hemianopsia, and things like that. We'll talk about that in a little bit. That way you have a little thing that shows what the visual field is and what portion of the eye sees what. So when you look in with an ophthalmoscope, you're looking at the retina. The retina is basically the part of the eye that's sensitive to light. So it covers more of the back part of the eye. So it's going to be like maybe all the way like this. Okay? And then the macula is the part of the retina where there's most concentration of some of the sensory organs, and that's where you're going to see central vision. Okay? You probably heard of macular degeneration, right? That's where they're degenerating at the macula, and you'll have a loss of central vision. Now, you're better off losing your peripheral vision rather than losing your central vision. And then basically, you can see how on this, where you have the optic nerve, it's not going right directly to the back side of the eye. It's a little bit more on the nasal side of the eye. So that's why where it says optic nerve head, you can see that yellowish area. That's where the actual nerve, if this is the back of the eye, that's where the actual nerve is going in right in that area. So that's where the nerve fibers are coming in. So you're going to have a blind spot right there. And that's normal. And so then when they're looking through the ophthalmoscope, they're looking for a sign of pathology, hemorrhaging, things like that, optic nerve atrophy, papilledema, diabetes can affect the eye, hypertension can affect the eye. And for brain purposes, you're not really going to be doing ophthalmoscope exams. But you just want to understand what people are looking for. What you may do is you look at the pupil. That's where basically the opening in the eye, and it can become larger or narrower depending on how much light is in the general area. And the pupil should be black, and you know what cataracts are, right? Where you have a clouding of the lens over the eye, then they can get more opaque or white. So talk about disorders of the optic nerve. So you have papilledema. So edema is swelling. So basically, it's where that nerve is coming in, right here. Right? If there's increased intracranial pressure, that's where that pressure is going to manifest itself. Right where the optic nerve enters the eye. Okay, so you'll have an enlargement of that area due to increased intracranial pressure. Okay? There can be other types of swelling that can appear there, but only if it's from increased intracranial pressure is it called papilledema. You can have other things like malignant hypertension, thrombosis of the retinal vein or something, and they're not going to produce papilledema. The only thing that produces papilledema is increased intracranial pressure. And when they find papilledema on a ophthalmoscope like that, you've got to find out what's causing it. There could be some type of neurologic condition, a tumor or something like that. The optic disc is the surrounding area where that optic nerve comes in. Okay? So you're going to get swelling in that optic disc, which is a circle that's a little bit around the area where the nerve comes in. Okay. I mean, the retina is the whole surface of the eye that has the rods and cones and things like that that can pick up light sensation. But the optic disc is that smaller, more central area where the nerve comes in with the optic nerve.